Biceps tendinitis. When we refer to biceps tendinitis in the shoulder, we are most often referring to the long head of the biceps brachii. This tendon runs up the front of the arm, over top of the humeral head, and attaches on the shoulder glenoid. In most cases, biceps tendinitis refers to irritation and inflammation of the tendon tissue. This inflammation can lead to a thickening and swelling of the tendon sheath that may result in tenderness and soreness. Causes of biceps tendinitis. Overuse of the tendon in sports or repetitive overhead movements in work or daily life. As we age, tendons get stiffer, weaker, and more prone to injury. Injury to the tendon from a fall or other accident. Smoking has been associated with an increased risk of tendon damage, along with slower healing due to poor circulation. Symptoms. The most common symptoms of biceps tendinitis include pain and tenderness in the front of the shoulder that may be worse when raising your arm, stiffness in the shoulder, possible weakness in the shoulder, clicking sensation when using the arm and shoulder, swelling. The pain may be worse at night and disrupt sleep. Pain with palpation over the bicipital groove is a common physical finding for patients with biceps tendinitis. Diagnosis. To diagnose biceps tendinitis, your doctor will ask about your injury and medical history. During the physical examination, the doctor will assess your pain while moving the affected arm through a series of movements and pressing on the area of the biceps tendon. Your doctor may order X-ray. It is not usually helpful in confirming biceps tendinitis, but may help evaluate factors that led to the condition or rule out other problems. An ultrasound examination can help to confirm the diagnosis of biceps tendon injury. MRI to get more detailed images of the biceps tendon or other structures in the shoulder. Treatment. Biceps tendinitis is initially treated conservatively with rest, restriction of movement, and if there is severe pain, the shoulder may need to be held in a fixed position with a sling for 7 to 14 days. Place a cold pack on your shoulder and upper arm for 15 to 20 minutes at a time, 4 to 6 times a day to reduce inflammation. A doctor will recommend a non-steroidal anti-inflammatory, NSAIDs, to reduce inflammation and relieve pain. You will benefit from physical therapy to improve strength and range of motion in the arm and shoulder. If you still have pain after 6 weeks or more of activity modification and conservative treatment, your doctor may recommend an injection of a steroid into the affected area to reduce inflammation. The steroid is usually injected into the shoulder using a needle under the guidance of ultrasound. The paratendinous injection of PRP and stem cells showed success in the decrease of pain and disability. When it is possible to move the arm in all directions without pain, it is safe to begin slowly returning to normal activities or sports. Surgical treatment. Surgery is performed when the tendinitis does not respond to non-operative interventions, and can involve simply cutting the tendon, known as a tenotomy, or cutting the tendon and inserting it into the upper part of the humerus. It is performed either via arthroscopic or open surgery. Rehabilitation. For about 4 to 6 weeks, you will need to wear a sling to restrict the use of your arm and let the tissues heal. The pendulum stretch may be performed for 5 to 10 minutes several times a day during the first few weeks. Physical therapy should be initiated after 4 weeks post-op to regain strength and function in the shoulder. You should be able to drive when you are no longer taking analgesic medications, and feel that you can control the wheel. This is around 4 weeks. By 6 months after surgery, you'll have good flexibility and strength and will be able to gradually return to sports and heavy work. And complete recovery may take even a year after surgery.